So I'll just go ahead and kick it off a little bit. So for those who don't know me, my name is Belle Stixrud. I'm with Living Well, and I'm so excited to introduce my dear friend, Dr. Lauren Craig. I am super excited because I actually met her way back when at University of Oklahoma back in the day. So I'm just so happy that she's here. But just to start off, so Dr. Craig serves in the athletics department as the assistant director of counseling and sports psychology services. And she has a long list of all of her trainings. So she completed her bachelor's degree in psychology from Midwestern State University and her master's degree in counseling psychology from the University of Central Oklahoma. And then she earned a PhD in counseling psychology from the University of Oklahoma, Boomer Sooner, where she worked in the psychological resources for OU student athletes, otherwise known as pros. So she also completed her doctoral internship with the Student Counseling Service at Texas A&M's Student Counseling Service, where she received specialized training and works with student athletes under the supervision of Dr. Ryan Pittsinger and Dr. Mary Ann Cubby. So without further ado, Dr. Craig, you can take it away.
Awesome. Well, thank you all so much, so much for inviting me to speak on this, for taking the time out on your Monday to join us. Belle, I love the introduction. Thank you for taking a little bit of time off of me needing to talk a little bit about who I am and where I work. But yeah, I'm absolutely loving working in the athletics department, love working with our student athletes. Part of what I also do within my role is I oversee all of our ADHD learning disorder assessments, screenings, kind of treatment, and kind of getting them connected to any of the academic resources, accommodations that might be helpful for them while they're student athletes here. So I just really appreciate the opportunity to connect with you all and talk about this topic. It's a topic that I'm super passionate about. I feel like I continue to learn and grow in this area. It's fascinating to me, so I'm just really glad to share the time with you all. As Belle mentioned, my hope and plan is to leave plenty of time at the end to answer any questions, kind of have any dialogue that might be helpful. I will say, so feel free as I go through here to put things in the chat, as she mentioned. And thank you, Belle, for monitoring that, because I would definitely not be able to manage all of that at once. So just kind of hopping in, a little bit of a brief outline of how I hope we can kind of spend the time today is really just spending a few minutes kind of talking about the history of ADHD. How did we come to use this terminology? How did we come to understand it? What do we look for with that? What are the most common signs, symptoms, traits? What goes into an ADHD kind of testing or kind of the diagnostic process? What are some treatment options that might be available to individuals who either receive a diagnosis or feel like they're kind of coping with some of the symptoms of ADHD? Some additional tips for managing it, and then some support and resources. So I know it's a lot to cover in a short amount of time, so I will try to stay on task here. But again, just like we said, kind of a brief history, a little bit of a journey together. So what we have come to know as ADHD, what we call ADHD, was actually first identified in the early 1900s by a British pediatrician, Sir George Still. And he identified a group of kids who seemed to have trouble paying attention. But one of the things that he kind of labeled this behavior as is he kind of labeled it as what he quoted as a defect in moral control, which, as you can imagine, super negative, super stigmatizing. And it wasn't until the 1920s when another researcher, Franklin Ebal, actually noted pretty similar symptoms in a group of kids who had illness-induced brain injuries. And his argument, kind of noting some of these similar symptoms, this was kind of the first transition that really helped us suggest that the condition wasn't a behavior problem or a discipline problem or a moral problem, as Sir Still said. But instead, it was kind of our first indication that this was one of mental differences, that we actually had differences in our brain and the way it functions. And so other research after Ebal continued to add to this knowledge base and went on to find that ADHD often runs in families and can have a genetic basis. So kind of continued to build up that support for, hey, this isn't a moral problem. And hopefully kind of starting that language of taking a lot of that stigma away from ADHD, ADD, and the symptoms we may experience. And then, so kind of some of our experiences within the US, just a real brief history. So it wasn't until about 1980 where we first started seeing and using the term ADD. So the DSM, when I'm labeling that, that stands for the Diagnostic Statistical Manual. So that's basically our main source for, or resource that we use for helping line up symptoms and saying, hey, does something fit within a criteria that somebody meets criteria for a diagnosis of any kind? And so in 1980, when the DSM-3 was released, that was the first time we saw ADD. And so you notice there, hyperactivity at that time wasn't really considered a super frequent symptom. And so people would label it as either ADD with hyperactivity or ADD without hyperactivity. And then about 7 years later, DSM-3 came out with a revised version, and that's where we saw that first official shift in starting to use and add the hyperactivity component, where we actually see now ADHD. So ADHD is now the most common. You will still hear here and there people say ADD. For the most part, in some ways, it's kind of considered outdated, but it's not like, you're not wrong for saying that. It's just used more often to say ADHD. Then in 1994, the DSM-4 came out, and they changed the official name to Attention Deficit Hyperactivity Disorder, and they added that little forward slash. And that little forward slash carried a lot of meaning with it. It basically indicated that you could have either or both. And so this was the first time here in 1994 that we start to see what at that time was called the 3 subtypes. So predominantly inattentive, hyperactive, impulsive, or combined. And then several years later, 2013, that's when our most recent version of our DSM was released, DSM-5, and we kept pretty similar. We kept the 3 subtypes, but now we've shifted that language, and the language that we have around it now is, we now call them presentations. And this was important for a number of reasons. What was really helpful about shifting some of that language is it helped take into account how characteristics can present in both children and adults. Prior versions, it was kind of argued that symptoms or signs mostly focused on how it presents in children, and that may not always be accurate. So it was really helpful to say, hey, we're not overlooking the ways in which symptoms can present throughout the course of somebody's lifetime. So that's kind of the brief history of it. In terms of the terminology that we use, but we've also seen some shifts in how we understand ADHD, right? So today we have much greater insight into how the brain works, what ADHD looks like. And so other than just the name changes, our understanding of what it means to have ADHD has shifted as research has continued to shed more light on different forms of what we've come to know as neurodivergence. And so I always like to start by talking about this with, hey, when we talk about ADHD, and if somebody meets criteria for a diagnosis, it is considered one that is a disability, but this is primarily because society is what we would call neurotypically centered. So ADHD is not an abnormality. There's nothing wrong with you if you're diagnosed with ADHD. Instead, it represents a form of neurodivergence, which basically means differences in the way a person's brain functions, right? So we may behave or learn or process information differently than what was regarded as neurotypical. And this is kind of some important language, I think, to use because it helps us shift from, hey, if this is a genetic neurotype, it's not a disorder that needs to be cured, right? There's nothing wrong with you if your brain thinks and processes information differently, so there's nothing to fix. Instead, it's more of, hey, how can we become aware of it and learn how to manage it in ways that's going to help you be successful? And so along those lines, we've also shifted in our understanding of ADHD is not just one condition, right? It's more of a umbrella or a cluster of symptoms that can and do change over time. And they present and can present quite differently from one person to another. And so we're really doing ourselves a disservice if we assume that it looks and feels the same for every person at every point in their life. And so having that broader view of that is going to help us help ourselves, like knowing ourselves more, but also when we're interacting and relating with people who have ADHD, it's also helpful to keep that in mind as well. And so kind of to that end, like we've mentioned, it's not a childhood phase. It's not something that we grow out of. All of the research shows that if you are diagnosed as a child, anywhere between 60 to 90% continue to experience symptoms and live with it as adults. And I would argue that most of the research is showing that, again, it might just present differently as you continue to age. And so there may come periods where you may experience less symptoms or it may feel less overwhelming to manage, but kind of coming in waves throughout your life versus, oh, I'm in remission, or I don't experience anymore, I've grown out of it. So it's often helpful to think of it as a lifelong experience. Some real quick prevalence rates. For children, we do know that it is most commonly right now diagnosed when we are children. So as of right now, there's approximately 6 million children in the US between the ages of 3 and 17 who have been diagnosed with ADHD. We've seen those numbers grow significantly over the last 20 years. There's been a 45% jump just between the years of 2003 and 2011. So that means that our current reality is that 1 out of every 10 children in the US are living with an ADHD diagnosis. And so while some of these statistics about these growing rates can feel pretty alarming, I think it's also helpful to kind of note that this increase is likely a reflection of how our medical community has become better aware of and educated about ADHD. And so kind of the positive flip side is the more we've learned about it over the years, the better we're getting at diagnosing it more accurately and earlier. So we're knowing what we can do to help people with the condition throughout their lifetime. So, 2 sides of that argument to kind of keep in mind. For adults, we also know the number of adults who've been diagnosed has also been on the rise. Currently, you're going to see rates anywhere from about 4.5% to 10% of adults between the ages of 18 and 44 have been diagnosed. And we do know that a lot of these trends or a lot of this increase came into a sharper focus at the height of the COVID-19 pandemic. We saw a spike in adult prescriptions for stimulants during that period of time. And we're also just recognizing that in general, adults tend to be a group that can be overlooked in ADHD diagnoses. And we'll talk about reasons why here in a little bit. But that being said, even though we are seeing an increase in diagnoses and presentations, it's still important to note that a lot of research actually shows that less than 20% of adults who may experience ADHD are accurately diagnosed or accurately being treated. And this is important for a number of reasons that we'll get into. But one of the reasons that people argue that this might be the case is that practice guidelines from all of our medical boards and things like that, they're pretty clear and pretty straightforward when it comes to how we would treat a child with ADHD. But there haven't really been any formal guidelines established as clearly for adults. And so that's something that we continue to need to improve in the future, and that we are making improvements in. So what are some of the common signs and symptoms? I really come to appreciate, I think, this image, I think captures it really well. It's a metaphor, an analogy that really commonly helps represent the experience of having ADHD or living with somebody, interacting with somebody that has ADHD. But it's really to kind of highlight that those external symptoms that I think are probably the most easily recognized or the most common are really just the tip of the iceberg, right? So the restlessness, the hyperactivity, difficulty, staying focused, maybe feeling more irritable. Those are things we can see. right? And so those might get clocked more easily by people and receive intervention for. But it's important to remember that the overall experience of having ADHD is so much more than that, right? And so the internal experience that we don't see takes a toll as well, right? Whether that's managing difficult or strong emotions, right? Trouble making decisions, trouble either initiating motivation or staying motivated throughout the duration of a task, having racing thoughts constantly. One big one I think is called like choice paralysis. So feeling like I've got so many things to do and I don't even know where to start. So I don't start any of them, right? And I may end up procrastinating. Time blindness. So either having like not feeling like I know, or feeling like things will take less time than they actually do take, or feeling more confident in my ability to finish it in a certain amount of time and then it always takes longer. So I'm feeling chronically behind. Being overloaded, like sensory wise in our environments, organization, whether that's our time management, organization of our living spaces, sleep disturbances, right? So maybe having trouble falling asleep, staying asleep, waking up throughout the night. And then low self-esteem, right? So maybe feelings of self-doubt or constantly questioning, you know, am I forgetting something? Did I let something fall through the cracks? Did I do something good enough? These are all things that can take a toll as well and overlap and show up in how we experience ADHD. But most commonly, this is what you'll see. These are the traits, what we call diagnostic criteria that's within the DSM. So as we mentioned, there are 3 presentations of that. The inattentive presentation, so those are things such as making careless mistakes, having trouble keeping our attention, getting feedback that you don't feel like you're appearing like you're listening when somebody's speaking to you directly, even if you are listening. Maybe starting a bunch of tasks and kind of hopping around between them, but not really finishing any of them. Trouble organizing, like we mentioned, whether that's our time or our living spaces, losing items easily, keys, wallet, phone, things like that. Feeling easily distracted, whether that's by internal things, so my to-do list that's constantly running in my mind, or more external things, so sounds going on around me, people walking by, my phone going off, things like that. And then feeling easily forgetful, right, of due dates, appointment times, things like that. Other people's birthdays that we know and we love and we care about, and we would never feel like we would forget it, but we may easily forget it. Those are all things we may experience. The hyperactive impulsive presentation, again, these are more of the things that we feel like we more easily see externally. So somebody that's getting up frequently, that's really restless, that's talking or engaging in behaviors where they feel like they're like driven by a motor. I call it like the Energizer Bunny feel. Talking excessively or blurting out answers or responses. A lot of times when I'm talking with our students, it's sometimes they get feedback that they're rude or that they're always cutting other people off, and we'll have conversation about it and they'll say, well, I never want to be rude. I'm just so worried that if I don't say it right then, I'm going to forget it by the time they're done talking. And so I like butt in and I just want to make sure that I get it out, and so they may get feedback, even though that's never their intention to be rude. Trouble waiting their turn, interrupting, intruding on others, like we mentioned. So all of these are kind of the most common ways that we see it kind of show up or that we see. And then the combined presentation is when we see elements of both. So when we're looking at like a diagnosis, we're looking at a couple of different standards. So for kids, we're looking at, they have to have 6 or more of either of the categories. So either 6 or more for inattentive, 6 or more for hyperactive, impulsive, for a period of at least 6 months. And they have to be intense enough that it's interfering with their ability to kind of function in their daily life, but in more than just one area. So it's not just showing up at school. It's also they're struggling at home, in their relationships with their friends, things like that. For adults, we're looking at the same time period, but it's 5 or more symptoms for either one of those categories. If we do have symptoms that show up in both, so 5 or more of both of those, then we start looking at perhaps a combined presentation, which is the most common of the 3 from a DSM kind of standard perspective. Okay, and so again, from that lens, that's more the DSM kind of official traits. I do think it's important though that we kind of acknowledge that there's other ways, other observed traits and how this shows up for people and how we experience it. So thinking through things like a progress speed. So like we mentioned before, if we're somebody that we start a bunch of tasks and kind of hop around, we may feel like none of the tasks get done, or it takes me a really, really long time. And that can be our daily tasks, our household chores, school, work assignments. And so they may just take longer to do than some of your coworkers or your friends or things like that. So progress speed may look a little different. Hyper focus is also something that I think probably gets overlooked. So hyper focus is something that can definitely be engaged for people who do experience ADHD. So while we definitely tend to stay away from things that are boring or uninteresting, if there is a task that is interesting, we can engage in that hyper focus, which means that's going to be the sole thing I'm focusing on, and I'm super productive in that. But oftentimes that comes at the expense or detriment of things that I also need, like sleep, social interaction, getting some other tasks done, and things like that. So just keeping in mind that it can kind of show up on both ends of that spectrum. Like we mentioned again too, like low self-esteem, right? Worrying about, did I forget something? May have self-doubt after receiving feedback over, years of feeling like, hey, I'm either falling short of my own or other people's expectations. And that takes a toll, can lead to having low self-esteem, confidence, anxiety, things like that. There's also been a lot of research that's uncovered some connections between ADHD and chronic fatigue syndrome. So we mentioned a little bit ago, like the sleep difficulties, falling asleep, staying asleep, waking up a lot throughout the night. But there's also a chronic fatigue syndrome where those main symptoms are like overwhelming fatigue, maybe muscle joint pain, and then problems with cognition, or what we call like a brain fog. And we know we've seen in research that there's some really common symptoms with ADHD, like problems with concentration and attention. And so what they found is that upward of 50% of adults who have been diagnosed with ADHD do show some symptoms of chronic fatigue. So that's just an important thing to kind of keep on our radar as well. That indecision paralysis we mentioned, it may come across as avoiding or procrastinating on tasks, not knowing where to start, overthinking a problem. It's kind of that feeling of no matter what I'm doing at this moment, I feel like I should be doing something else. But if I go start to do something else, I feel like I should be doing another thing. And that cycle continues where you're just constantly feeling like I'm not getting anything done nor doing anything well, which again is exhausting, right? And then lastly, irritability and anger. We know that about 70% of adults with ADHD report feeling more impatient or quick to anger than those who do not have ADHD. So we know emotion dysregulation or difficulty managing emotions is a major key part of living with ADHD. And because ADHD impacts our impulse control, it would make sense that it can also impact emotional responses like anger, right? And so maybe feeling overwhelmed with daily responsibilities, any relationship difficulties that are going on, feeling interrupted or having to switch tasks when you're trying to focus, right? Anything of that can feel easily triggered and just cause some of that added frustration and exhaustion. And then lastly, kind of talking through symptoms, I think it's important to note that there are differences in the ways that both males and females both maybe experience symptoms, but also how they're recognized and diagnosed or not diagnosed. And so before I kind of dive in this, please know, like when I'm talking through some of these statistics, we're referencing biological males, biological females, not referencing any of kind of the gender identification or anything like that. But what we do know is that diagnostically throughout the course of a lifetime, boys or males tend to be diagnosed at a higher rate than girls or females. When they're children, this rate is about double for boys than it is for girls. That rate, so about 13% compared to 6%. For adults, that rate shrinks quite a bit, but we do still see a slight increase in diagnostic rates for men versus women. There's a lot of research on why and the different reasons why this may be. The most common one that we kind of talk through is simply kind of, again, the most common symptoms that are experienced. So for males, it might be more easily observed because the symptoms that they experience may be more of the impulsivity, hyperactive behavior, interrupting, intruding on others, having trouble sitting still. So some of the things that are more easily seen. So it gets clocked and it gets intervened with and diagnosed. Whereas for women or females, we may see a lot more of the internal symptoms that aren't recognized as easily, or they can often be misattributed to other things that often overlap with ADHD, which we'll talk about. But we do see for a lot in females experiences of whether it's depression, anxiety, stress, low self-esteem. A lot of times people will misattribute some of the attention difficulties they may be experiencing. And so they may miss an opportunity to be diagnosed and get specific interventions for that until a later age. And again, we'll talk more about that here in a little bit. But I was really struck by, and I really appreciated a quote by Dr. Akasha. So she's on the medical advisory board for one of the national ADD organizations. And she acknowledged that in terms of research, we're still very behind when it comes to understanding how ADHD presents in females. And so because of that, it's understandable that most women get diagnosed at a later age, such as their 30s or 40s, compared to, say, boys or young men. So again, I thought it was just really important to acknowledge how that shows up, and we'll have a little bit of time to talk through some of that too, moving forward. All right, and so now we've kind of understood, like, hey, okay, what are some of the signs and symptoms we may look for? What goes into, like, let's say I notice some of these things about myself, like, what should I do? How do I go about getting a diagnosis, right? So we're going to talk through that a little bit. But first, I think it's really helpful to talk through some of the theories or some of the things that have been said about potential causes, like what causes ADHD. The short answer is there's no clear-cut answer, right? There's no just one reason. More often than not, what you're going to hear is it's likely a result of a combination of both genetics and then environmental influences. So those for sure would be the two biggest factors. From a genetic perspective, we do know there's a lot of evidence to suggest that genetics are involved. One study even showed that up to 75% of children who go on to be diagnosed with ADHD also has a relative who has ADHD as well. But there's also been some research for both brain differences and chemical differences as well. But before I dive into those, it's important to note that ADHD at its core, if y'all take nothing else away from our time together today, it's known as a neurodevelopmental disorder because its onset is during the prenatal kind of developmental period. So what that means is never forgetting that the condition starts in childhood. It always starts in childhood, not adulthood, right? So if you have ADHD, if you go on to be diagnosed with ADHD at a later time, you were born with it. You don't develop it at a later stage. You just may be diagnosed for the first time as an adult, but it is neurodevelopmental. You've always had it. Again, because we've talked about the different ways it can show up, it just may present itself in different ways that interfere with your functioning at an older age than maybe when you were a kid. So that's important to kind of keep in mind, no matter which kind of cause or theory we're talking about. So that being said, some of the brain differences that have been noted is primarily related to what we call the prefrontal cortex. So that front part of our brain that's really responsible for all of our executive functioning skills. So things like staying organized, being able to lock in focus and stay focused, our memory recall, right? Our ability to plan a task, to monitor ourselves doing a task, and then seeing a task through to completion from start to finish. All of those things have to do with executive functioning. And we notice distinct brain differences between individuals with ADHD and individuals who don't have ADHD. That being said, when we're talking about brain differences, even though those exist, that has nothing to do with somebody's IQ, their intellectual or cognitive potential. Those are two separate things, but we do know that it just shows up in terms of, again, how our brain processes and uses information. And then lastly, chemical differences we've seen. The two primary ones that we see a ton of research on are for dopamine and norepinephrine. So when we are looking at medications to kind of target and help treat, those are the neurotransmitters, the chemicals that are targeted most frequently. So using the example we talked about a little bit ago with the choice or indecision paralysis, we see this a lot as a really good example for dopamine. So dopamine in a lot of ways can be thought of as like the go signal in our brain, right? And so if, we have a task, so like all of us experience, whether you have ADHD or you don't have ADHD, all of us experience tasks that are unpleasant, that we don't enjoy doing, that we may put off doing, right? The difference is that individuals with ADHD have been found to have chronically lower dopamine levels than individuals who don't have ADHD. And that dopamine level is very important in the process of actually initiating enough motivation to act on a desire to get something done. So for an individual who has stable dopamine levels, you may still not want to do a task, but the idea of being done with it, the idea and being able to kind of picture how good it's going to feel when you're done, kind of helps initiate that go signal in our brain enough to do the task. Whereas somebody with ADHD, there's no dopamine level in the world that's going to be able to help activate that go signal. And so this is kind of like a deficit that's known as delay aversion. So there's not enough dopamine to translate that future reward into enough present motivation to get the things done that they want. So just kind of keeping in mind that's maybe how it would show up. And the medications that we use and recommend kind of help with some of those imbalances or those lower levels. Okay, so now let's say again, you're interested in looking into getting a diagnosis, going through the assessment process. What does that look like, right? Because we know the earlier and the more accurately we can get a diagnosis, the more helpful it's going to be for us long term. So what's involved with it? In an ideal world, an assessment is a super, super thorough process. So there's no like singular test that's going to, be enough to just clinically diagnose someone. It's most helpful when we use multiple tools to determine, again, maybe what's ADHD, but what might be some other things that are showing up. So first and foremost, it's really helpful if you can get a physical or a medical exam. That's to also check how's your vision, how's your speech, how's your hearing. Those things impact, right? Do we have any history of concussions or other traumatic brain injuries? That could impact and show up as attention-related difficulties. Any sleep difficulties, like we've mentioned. For cognitive assessments, the most common ones we'll see is called the Wechsler scales or the Woodcock-Johnson. Those are the two that are most common. Really, the goal is to kind of figure out how do you function in each of these different cognitive areas, like verbal comprehension, your working memory, your processing speed, your ability to recognize patterns and problem solve. The key thing to keep in mind here is the goal is not to say, again, like your IQ determines anything or your potential. It's really to kind of help determine where are your strengths and weaknesses as an individual. And that really helps in like any treatment planning and kind of tailoring any like accommodations or strategies that you use to help cope with it to make sure that it's working the best for you. One thing we'll see with individuals who struggle with ADHD is things like processing speed might be a lot slower. Working memory, there might be some struggles. So compared to those who don't have ADHD. So being able to know that about ourselves, that helps us tailor the different strategies that we use to kind of cope with that and to help communicate that to others who are working with us too. Self-report assessments, we'll also see those. These are by no means like an exhaustive list. These are just 3 of the most common examples we'll see. Connor's adult ADHD rating scale, the adult symptom rating scale, and then behavioral rating scale for executive functioning. So those are the 3 that I use the most commonly, but there are a ton out there. Really, the goal is to just get a feel for how often you feel like you experience symptoms that, again, are in line with the criteria that the DSM uses for a diagnosis. And then interviews, I think it's always helpful to get as much information from other sources, from people who know you well and interact with you, to see what they're observing as well. Whether that's our parents, spouses, partners, teachers, whatever outside information we can get is super helpful. And then again, like we talked about, part of that diagnostic process is saying, okay, hey, like, how many symptoms do you have? How long have you had them? But also, in what ways are they impacting your daily life? So just a reminder of the different ways that the different impairments or the different struggles that we may experience in these different areas, and your overall quality of life if you are struggling with undiagnosed or untreated ADHD. So whether that's difficulties at school, difficulties in your relationship, feelings of confidence, just the day-to-day tasks. Substance use, we do know that people with ADHD are 3 times more likely to either be nicotine dependent, 50% more likely to develop a drug or alcohol use disorder. But the good news is that we also know that treatment with ADHD medication significantly reduces substance misuse. Same thing with mortality. There is a slight increase in rates of premature death, mostly due to accidents and suicide. But again, same thing, long-term treatment with ADHD medication significantly reduces accidents and the risk of suicide, which is, again, another data point for how important it is to just be aware of the symptoms, how it shows up, and getting the treatment that you or a loved one may need. And then the last part of kind of the diagnostic process is ruling out any other conditions or experiences that may present as ADHD, may overlap with attention difficulties, and making sure that we're getting the right diagnosis so that we can get the right treatment, right? We do know that ADHD symptoms overlap or coexist with a lot of different conditions. This is by no means an exhaustive list of the conditions that it may overlap with, but just being mindful of the ways that experiences, in some cases, attention difficulties aren't ADHD at all, but might be part of anxiety or depression, which have attention features, right? So making sure that we're ruling out standalone psychological conditions before assuming that ADHD is the main kind of culprit in that example. That being said, it's also important to acknowledge ADHD rarely occurs alone, right? We do know that 50% of those who are diagnosed with ADHD have some sort of coexisting condition, whether it's sleep, a learning disorder, anxiety, depression, speech difficulties, right? Like any number of things. So it is possible for things to overlap, but it's also possible for things to exist at the same time. So really having, again, that thorough assessment is going to help you get the most thorough and helpful treatment for what's going to work best for you. All right. And so why do a lot of adults go undiagnosed or untreated, right? There's a number of reasons for it. I think a lot of it too is, again, our education, our awareness is increasing. So we may have parents, grandparents who, may have struggled with some of these things, but like ADHD wasn't a thing, or we weren't aware of how it showed up, right? And so that's something to keep in mind. We also know that intelligence, right? High IQ and being an intelligent human really helps compensate for some of the symptoms that we may see, right? So you may, if you are like have a high IQ, have a high intelligence, you've probably been able to make adjustments and adapt on your own through elementary, middle school, maybe even through high school. And so sometimes it's not even until you get to college where the structure of your classes change, the time pressure, the different like intensity of your courses, where now what's being demanded of you kind of outpaces the adaptations, the adjustments you've been able to make. And so it's actually really, really common for those with high IQs to get diagnosed later in life when that starts to present for the first time or impact them differently at that stage of their life. Same thing for structured support, right? Like, so parental support, the way school is structured, right? Having, like in public school, right? When you're like elementary, middle, high school, you've got a lot of assignments. And so even if you do badly on one assignment, you're able to make up for it, right? Whereas you get to college, then you have 3 or 4 maybe in one course. And so that takes a big shift too. And so structured support throughout may mask some of that functional impairment. Again, the diagnostic criteria, like we mentioned, it's improved, but a lot of times it's focused primarily on symptoms that develop in childhood. So we may miss how it shows up in adults if we're not careful. And like we mentioned, the co-occurring conditions are really, really common. And so ADHD symptoms may be missed or misattributed. So let's say, okay, you've gone through that process. Now, what are some treatment options available to you? Again, this is a very quick snapshot. Many adults with ADHD do find that medication can be an effective treatment option. It's always important to remember it's not a cure. It's most often used as part of a comprehensive treatment plan that includes, therapy, other kind of behavioral lifestyle changes. But really the goal of medication, if somebody pursues that, is to help the individual be the best versions of themselves, not necessarily to change who they are or fix them, right? So if somebody chooses medication to be a part of their kind of treatment package, if you will, the two most common ones that are used are stimulants versus non-stimulants. So how medication can be helpful, can help improve focus and concentration, reduce impulsivity, hyperactivity, and help improve sleep and appetite in some cases. There's always exceptions, but those are kind of the main ones. For stimulants, these are kind of a snapshot of the most common ones that are used. Stimulants are the most commonly prescribed, and they're also often the most supported treatment. They, again, work by increasing, like we mentioned, the levels of dopamine and norepinephrine in the brain, which helps us improve our focus and concentration. You can have both short or long-acting versions of that medication. Common side effects can include decreased appetite, irritability, some sleep disturbances, and headaches. So it's really important to kind of work with your physician to make sure that you're monitoring kind of the risks and benefits of both of those and finding what's best for you. Non-stimulant medications are going to work primarily with the norepinephrine in our brain, less so on the dopamine, but again, can help with focus and concentration. Some of the therapeutic approaches, cognitive behavioral, super common. So working on ways of like behavioral strategies, time management, organizing our schedules a bit better, working on some mindfulness, being in the present moment, training our brain to do that. Maybe some social skills training, so picking up on social cues, navigating some of that, tendency maybe to like blurt in or step in a conversation. And then some other, treatment options that have been talked about are, some vitamin supplements. There's less consistent research on some of the efficacy of that, but it's definitely out there and definitely something that people could explore to kind of balance, whether it's iron, magnesium, omega-3s, things like that. And then nutritional things, nutritional considerations, good protein use, complex carbohydrates, things that are going to help with both digestion, but also kind of help blood sugar levels and all that good stuff. Consulting with a dietitian would be a great resource to consider and kind of talk through that. So I'll make sure I stay in my lane, but those are some things research-wise that we are seeing or have been talked about. All right, and now some tips for managing ADHD. I think it's always important to really start with acknowledging, because I think a lot of this we can focus on what we feel like people struggle with and what can be really frustrating, that we can sometimes overlook the strengths that do come with having ADHD, right? So like we mentioned, people with ADHD do have physical characteristics in their brain that lead to the symptoms of the disorder, but those characteristics can also lead to benefits too, right? Some of the main ones that I really like are higher energy levels, right? For better or worse, right? That's a good thing. I think really good levels of self-awareness, right? Learning their triggers and patterns, how to communicate those, how to seek and advocate for support for themselves. A sense of creativity, right? Thinking outside the box. Not just taking everything at face value. I think that's really important for things in school, but also business, like innovation, right? And then that impulsivity, I think it carries such a negative term, but it can also really be helpful for like spontaneity and, just keeping things fun, right? And so I think it's important not to overlook the ways that it shows up in strengths as well. Some tips for thriving, right? I think, again, this is not an exhaustive list. My hope is it's just a start of how we have a conversation, but I always preface it with saying the most important thing is making something work for you, right? So any of these, like it's not just take one and have to do them all. It's really finding what works best for you and leaning into working with your brain, right? Some of those things might be keeping things visual, right? Visual cues can keep important things at the forefront, keeping a schedule where you can see it, maybe a whiteboard, jotting down what you want to remember each day. One little resource that I found to be helpful that I saw that I thought was helpful was something like this, like a weekly planner. What I really liked about it is that it broke things down into like 45-minute increments versus like an hour or 2-hour blocks, right? Sometimes breaking them down into smaller pieces of time keeps it actually more realistic for us, and helps us work through the day a little bit more effectively. Determining what your level of stimulation is. So some people need background noise to focus on a task, right? Some people need complete silence, but set up your workspace to fit your needs, right? Remember that those needs also may change over time or on the situation that you're in. So being able to be flexible with yourself, changing that system as often as you need, right? Knowing that, hey, like our brain craves novelty, right? We already talked about ADHD, brains with ADHD process dopamine differently, right? So maybe making regular changes to your environment or your workspace can keep your brain engaged, right? When you notice your routine's not holding your attention or it's not as helpful as it used to be, making any small change that's going to help keep things interesting, right? That's going to be the most important for you, right? Using alarms and reminders. People with ADHD might experience what we call forgetfulness. So forgetting that we tend to be forgetful. And so, or often losing track of time, right? So keeping frequent cues, reminders can help kind of stay on track. Breaking tasks down, right? Taking things one at a time, giving yourself permission to take breaks, or stop, right? Like giving ourselves permission to say, hey, like half done today is better than not starting at all. All right. And it's okay to stop, even if I didn't finish everything I wanted to that day. Right. So giving yourself grace and having some of that compassion with yourself. I think sometimes people with ADHD and it often struggle, right? And like are hard on ourselves because we feel like, oh, we're not living up to these like neurotypical standards. But it's okay if you need to follow a different routine it's not a reflection of your value as a human, right? Letting go of that expectation that you have to do things that don't serve you, right? It's really unfair to you and to everyone to get down on yourself for having different needs or a brain that just thinks and functions in a different way. And then two that I really liked was body doubling and habit stacking. I actually engaged in some of that this weekend in finishing some prep for this presentation. So body doubling is essentially having someone else present with you while you complete a task, right? So it's a physical cue to help remind the person that's doing the task. It acts also as like an accountability booster. Habit stacking is like taking two things that you may not like to do alone or like by themselves, but then stacking them on top of each other. So you're knocking out two birds, right? Or like two tasks with one effort. So things like maybe folding the laundry while the dishwasher is running or calling a friend or family member while I'm grocery shopping. So like doing things like that. And it kind of makes you feel like you're tackling multiple things at once. But really overall is just making room for productivity, like being flexible with yourself, embracing the chaos that can sometimes come, right, with navigating a brain with ADHD, right? Realizing that it's going to be more helpful to make yourself happy than make yourself feel normal, whatever that sense of normal means. And really destigmatizing that piece of, just because it's a system that is in place for a lot of people, it doesn't always mean it's the best one, right? What's important is it's best for you and that you're able to navigate it in a way that you're getting the things done that are important to you, right? That's the biggest takeaway. Okay. For sake of time, I will skip over this one. I will make this resource available if anybody's interested. There is a really cool article that talks about how music can be helpful, the different types of music, how it helps our brain kind of work together to essentially tune out irrelevant information and help us focus, and the different ways that the different types of music that can be most helpful. So in your resource packet that I have here, I will be sure to include this one if you are interested. I thought it was a really cool article on how music can be helpful. And then lastly, before I open the space up for questions here, there was entirely too many resources and things to list. So I wanted to, if you feel free, if you scan this QR code, it should take you to a handout that I've created that breaks down several different resources, whether they're different books that I found to be really helpful, podcasts, documentaries, articles, is any and all things that my hope is can continue to build awareness, continue to educate ourselves, and have some additional resources. So with that being said, I do want to allow enough time to answer any questions. I see some stuff in the chat. Belle, I'm going to turn it over to you real quick.
I have to unmute myself. That's funny. Also, way to go with the QR code, because that's amazing. But yeah, we have just a few questions. So one you kind of touched on, but just in case you wanted to further clarify, is it protocol for adults to be screened for ADHD while being screened for depression and other mental health concerns? Because there's so much overlap.
Yes, great question. I don't think it's like a super standard protocol. I think it should be. I tend to for any person that I'm working with for like the first intake, the first appointment I have, I will be sure, like I'll say, hey, like kind of what's bringing you in. But as part of that conversation, I'm also asking about attention, sleep, how those things are showing up. I do think it would be really easy to incorporate just a real quick. A lot of those self-report questionnaires are like 1 page. They don't take long at all. They take like 5 or 10 minutes. And so I think it would be really helpful if you are meeting with a provider and say you're talking about anxiety or depression, to maybe even ask, say, you know, would it be possible for us to add in a screening for attention concerns as well, and kind of advocate for yourself with that. I think could be really helpful.
Awesome. And another question we have, if somebody is concerned about potential ADHD, what is the best way to proceed?
Good question. So I think there's a number of different routes. So I always recommend, if the situation allows for it, to do a screening first. The full testing process, as I walked through, can be quite gnarly. I think it's helpful to get that information, but the full testing can usually take around 3 to 4 hours. So usually if you're able to seek out a source where you can do a screening, whether that's, hey, I make an appointment with my primary care physician and I ask if they have a screening questionnaire available. I know for here, the University Health Services, they offer a screening process where it's kind of a shortened version. They do a few measures and they'll give you some feedback to say, hey, you know, it looks like it's trending this way. It might be helpful to get the full assessment. And then they provide some information about who and where to contact to get that full assessment if you're interested. I think those would be the 2 best places to start, would be seeking out a screening, again, whether it's through your physician or the University Health Resources here. If not, you know, looking through any psychologist, kind of seeing in the resource QR code on the handout, there are a couple of websites that have listservs or lists of like local or statewide providers in your area that provide this testing or screening process as well. So that would be a helpful place to start. And then for those who are maybe navigating with insurance, you can always also contact your insurance company and they can help get you connected to providers in your area as well who might provide this testing.
Awesome. Well, cool. We have a lot of excitement about the resources about music as well. So please send that over. You can send everything to me and I can send this to everyone who registered. So that works as well. And Perfect. Then also, let's see, I'm just scrolling down. It says some people needed to really advocate for themselves because they felt like their concerns were disregarded by their psych and their PHP, which that happens often. And then another question is, even as adults, do you think there's a concern of over prescribing ADHD meds? I feel like some doctors will just prescribe all the things.
It's a really great question. I'm really glad you brought that up. We did with the increase in since we did see a bunch of this increase happen over the COVID-19 pandemic, a lot of the research, what we saw is that a couple of things happened. Number one, testing shut down because we weren't doing in-person services anymore. So it was really common to have virtual appointments with prescribers or physicians. And so it was acknowledged that that was a lot of the factors going into that big spike that we saw. And so that is something that we're now realizing, hey, like we may need to kind of look into further and make sure that we're getting more of a thorough diagnosis like you're mentioning. The second thing that happened is I think that we were all home. We had access to our social media a ton, and I think that there has been a number of people that are saying, hey, like while we have increased access to information, also making sure that that information that we are having access to is accurate and truthful, or well, like science-based or evidence-based. And so I think kind of a combination of either people seeing information that turned out to be not helpful and then kind of flocking to like a virtual provider who would write a prescription. I do think that there is some merit to that piece. And so just being mindful of the ways of, hey, if that is something that you received a prescription, being mindful of the ways it impacts you, and then maybe even going that step further, like the person before mentioned, it may, like fortunately or unfortunately, fall on the individual to advocate for themselves of making sure that that's still fitting their needs and treating the symptoms most effectively. Because we do know if you're prescribed a stimulant and if the predominant problem is anxiety, it's going to spike that anxiety up too. So you might be taking stimulants, then my anxiety symptoms get worse. We need to make sure that we're actually treating the symptom that's like the most impactful and finding that best combination for you.
Awesome. And then of course, someone asked if you could send the link to the university resources, but that can also be included in the email you send me that I can send out to everyone. And then how can I support or help or support my partner who has ADHD? Do you have any general tips like for routines, decision making, and irritability?
Yes, for sure. Yeah, so I think that's a great question. I think it's always helpful to, again, kind of keep those lines of communication open of saying, hey, like, how does this show up for you, right? Like, knowing that you have ADHD, like, what are the symptoms that you experience the most often? How does that look for you? And how do you know, like, when you're struggling more so with some of these symptoms than not, right? Because like we mentioned, the ways these symptoms present and show up can kind of wax and wane. And so some days or months may be easier or harder than others. And so being able to almost kind of like tag team or collaborate on, hey, what are some things that I can look up for? How can I support you? What's most helpful in these moments where you're feeling really scattered, or you're having trouble getting things turned in, or you're feeling more irritable? Like being able, like in a place of calm, being able to talk about and almost like game plan together, so that by the like when these things then get activated or increasing, then we feel like we've had a conversation about that and you're kind of approaching it as a team. And then I think for anything like routines, decision making, just making sure of like anything that we try to establish feels realistic and we revisit it, right? So we don't just like make a routine and do that. We say, hey, like, is this helpful? What do we want to change? In decision making, maybe we give a timeline for it of saying, hey, like, we need to make a decision by next week. When do we want to check in about this? And kind of give some kind of build in some check-in points. So it's not like we need a decision by tomorrow. That sets us both up for failure, right? And so just being able to kind of collaborate on that and figure out what's most helpful for y'all.
Good question. And also, what are your thoughts about virtual providers like BetterHelp?
That's a good question. Admittedly, I will say I'm probably less familiar with the BetterHelp and kind of some of the virtual providers. I admittedly probably need to be a little bit more well versed in some of those. I think just like anything, it's important to kind of know, like, hey, like, what are, like, kind of like the cite your sources, like what are your credentials, what's your training, and making sure that you also know, like, you should always be in the driver's seat of your treatment, right? And so if you feel like you're either not being heard, you're not feeling understood, or you're not feeling like you're getting the help you need, like feeling that you can ask for a different provider, you can shift to a different type of format, like modality. And so just kind of keeping those things in mind of that would probably be the biggest thing. And again, just acknowledging that I probably need to just be more well-versed on some of the services like BetterHelp in the meantime. But that is a really great question.
Awesome. And just as a personal note, if anyone needs help with breaking things down, if you like a good checklist, there's a site that I use. It's goblin.tools. I just put it in the chat, but you just enter in something. So like packing for a trip, and then you hit a chili pepper, basically how much do you want to break this down, and it will break everything down. So it says make a packing list, gather all necessary items, and it breaks things down for you. So if you need that additional help and you don't know where to start, you can just put that item into goblin.tools, and that's fantastic.
That's awesome. Yes, I'm so glad you said that. I meant to include that one on there, so I'm glad you put that on there. And then coming back really quickly to the one link to the university resources, it should be on that handout, I believe, under job and school accommodations. I believe I have the link to our Disability Resource Center website on there. So double check. If you don't see it, let me know. And to that end, here is a copy of my, my email address if you would like to reach out directly and talk further on anything that let me go back real quick that we discussed today. Feel free to reach out. I'm happy to talk further or one-on-one with anybody that I could be helpful for. One additional shout out, one additional resource that I do want to I believe I put it on the handout, but if not, I'm just going to go real briefly to the Very Well magazine. They had a special edition that came out this year, and it was focused solely on ADHD and new understanding. And I think it was a phenomenal informational resource. It actually has the article in there on use of music and how it can be helpful, the different types of music. And a lot of the information and resources that I found for this presentation were in there. So cannot say enough good things about that resource in particular.
Awesome. And I know we are at time. We have one more question, so feel free if you guys have to go, that's okay. But what about physical health? So what can we do to help sleep, hygiene, eating habits, exercise? Like what helps with ADHD?
Yeah, no, that's a really great question. I think kind of, just kind of building off of everything we put on that last slide there of, again, finding a routine that works for you. So one of the things I really liked about it is like, hey, not necessarily boxing ourselves in to feeling like I have to get the same like 8 hours of sleep a night. Again, a lot of the guidelines that we get are good. They're helpful. They can also feel really shaming to us if we feel like we don't fit that box really well. So I think the biggest thing is finding a sleep schedule that works for you. I do think having some sort of sleep schedule is important, but also having flexibility of knowing, hey, like there might be times where hyperfocus is engaged and I can crank out a bunch of work in 2 days and then catch up on sleep. We don't want that to be a chronic way of navigating life, but being able to be flexible with ourselves too, and knowing that we can do that and kind of catch back up. Eating habits, same thing. I found it really helpful with some of the just like some of whether it's protein, complex carbs, like how are we looking into the ways that we're fueling our body that's going to help keep our blood sugar regulated, maybe allow me to focus a little bit more easily, sustain for longer periods of time, which I do think, again, to whatever end your resources are available, connecting with a dietitian, talking through that and getting specific tips that would be helpful for you could be really helpful. Exercise, we know the mind and body connection is real, right? So when you're doing the Goblin tools, when you're doing things like that, like breaking things down, making sure that you're also building in time to move, to even take a short walk, right? A study break. Like if you're doing the starting, stopping, it doesn't have to be a full workout session. Go take a walk around the block and then maybe sit back down to do another 30 minutes of work, right? So again, being flexible and making it work for you.
Awesome. Well, thank you so much for joining us and presenting to us. I think I got a lot of compliments in here. Like, this is great. Thank you so much. So that's just all credit to you. So thank you so much for talking to us and telling us how we can thrive and just be amazing with ADHD, because it is a superpower. It for sure is. That at least that's how I feel sometimes, unless I
Oh.
don't take my Vyvanse. But I just want to say thank you so much. And for everyone, I will get those resources and I will email those out to you guys. So yes, there will be a recording and I will be able to put that onto our YouTube channel. So from Living Well at TAMU. So yeah.
Thank y'all so much for y'all's time and for joining us. I really appreciate y'all.
Awesome. Thank you guys. Toodles.